Thank you all for being here. I'm glad to see so many people interested in puppies and kittens and so many familiar faces from a variety of my life settings where I've been working. Kittens are close to my heart. I have opened this talk up and it will include some nods to puppies, mostly because I always feel like I neglect the puppies, but truly in our region, most of our shelters are overwhelmed by kittens, not puppies. So I'm going to apologize in advance that while I have some puppy information, I will invariably fall back to kittens as the default. So I'm apologizing ahead of time if you've come from a place where you're inundated with more puppies than kittens. I start this slide because I am the Janet L. Swanson Director of Shelter Medicine, and I wanted to give a nod out to Janet, who's with us today, and her kitten Hava. So Hava was recently rescued. This is a picture from probably 2 days ago. Hava was recently rescued from the floodwaters of West Virginia, where Janet, in addition to supporting our program, deploys with American Humane with the Red Star program to save animals in disaster situations. And so this is a kitten whose mother was washed away, 3 kittens left behind, and Janet, in addition to all the work that she does with Cornell and other organizations, has been bottle feeding this kitten, which is now her own. So nod out to Hava, who is a good illustration of the magic that we can accomplish with a little knowledge and a little extra time and a little less sleep. Is that fair to say? All right, thank you, Janet. So most of you, if you graphed your statistics on your kittens, would see that you've got this issue because I think most of us, at least in the Northeast and most shelters in general, have what we describe as Kitten Mountain. So this is statistics from one of our local shelters, and the blue line is indeed the kittens. Tends to be bimodal, and those peaks, if you can't see up close, are generally May to July and run right into September, October. About the time that we think it's over, we tend to get that second peak, right? And that's coming from second litters, and sometimes it's coming from litters from young cats that were born in the spring and have matured to that 4-month to 6-month window and having babies of their own. And I do find that the fall kittens are more challenging. But we describe this as our bimodal kitten peak. I'm happy to say this is real data over 4 years at our local shelter as we watched kind of our kitten numbers come down due to multiple efforts, including spay and neuter and TNR. So what are the issues with kittens in shelters? You know them. You don't need me to tell you. There's too many of them. Kitten Mountain, classic. And they exceed our shelter capacity pretty rapidly. Doesn't take long for a few litters to come in and suddenly we are over capacity for what we can handle. And they require a higher level of care in general. So that's your time, that's money. They can be very cost intensive. It involves a lot of people working really hard and essentially wearing themselves out a lot of the time. And it requires separate housing, ideally, so that we keep them from the infectious diseases that our adults are carrying and shedding. And so all of these things are seasonal. But that means we've got to be prepared for that season. And most of us, I think is probably true, are already running at a pretty tight budget with pretty limited space most of the year. And so this quickly exceeds our capacity for care. The other thing about kittens is they do have a higher level of morbidity, meaning disease, and mortality, meaning death, than a lot of our adult populations. And so this can be part of that emotional burden, part of that exhaustion, and part of that worry, even as they start to come through the door. We develop kind of a post-traumatic stress syndrome where we're already anticipating the worst, I think, a lot of times when kittens are coming to us. We're already worried before we've even laid eyes on them that they're going to be sick or challenging. So the reported morbidity and mortality, we don't have really good studies on this. I think shelters are doing a much better job of tracking it individually. But in the feral cat studies done in the 80s and 90s, up to 75% of kittens in feral colonies were reported to die. And in controlled settings like catteries and shelters, we generally see between 10 and 25. I'm happy to say a lot of our shelters, with some of the newer knowledge and some of the newer protocols around managing kittens, are seeing that drop down from 10%. And we're reporting in more of the 1 to 5% in a lot of places. But there are limits to what we can control with kittens. And so there's always an element of figuring out what can we do better and what is part of this process. It's reported to be about 10% in our puppy populations too. So we do have a cumulative exposure risk. The more animals that we have, the more diseases we're going to have, the more stress we're going to have. And I use this picture because this is a cumulative exposure risk in this foster home. If your foster homes start to look like this with kittens, you got to change something. If your shelter rooms are looking like this, you got to change something. If nothing else, you got to get rid of the guy with the lampshade on his head because he's probably contributing to your issues. So our capacity to provide humane care has limits. This is from our ASB guidelines. And it does in private homes, and it does in our shelters, and it does in our foster care settings. The other thing that we've tried to get better at in shelters is decreasing our length of stay for our kittens and our adult cats, because the shorter times they stay with us, the less likely they have that cumulative exposure to disease, the more happy we are when they go into those adoptive homes and minimize our care. And so this is some stats just looking at over the course of 4 years, how we sought to bring down the number of cats we were caring for, kittens we were caring for at one time. And most of this was managed simply by decreasing length of stay, managing our bottlenecks, figuring out how to get them to the adoption floor in a quicker but appropriate time. And so you can see that in 2008 in this shelter, they had over 250 kittens at one point in their care, just kittens. And this is a small upstate rural shelter. Over the course of 4 years, by trying to strategize bottlenecks, we brought it down to about 100, and that's held pretty steady for that shelter over the last 4 years. That was 2011, where we tend not to exceed 100 kittens at a time, which is great. That should be a goal, to really kind of make sure that you are looking at all of your strategies for managing them and meeting what you think you can actually handle reasonably. So when kittens come to us, especially kittens younger than 8 weeks, we do our best, but what they really need is this. What they really need is their mom. Moms are way better at handling neonates than we are, and we are really kind of poor substitutes. We do our best. I know each and every one of you does, but truly they need their moms. And so there are some elements before they even come to you of thinking about how can we keep kittens with their mom. So there's been some public awareness kind of campaigns that different shelters have done, and I really emphasize that this depends on your shelter, your region, what's manageable, what's appropriate in terms of humane management of kittens. But truly in this shelter where they were struggling with illness and with death of kittens, the goal there was to say, hey, if you find, this is a public service announcement for the public, if you find kittens, neonatal kittens, just kind of laying in your yard or in your barn, don't just snatch them up and run to the shelter, because their outcome may actually be worse given the numbers of kittens that we're dealing with. Wait at least 4 hours and see if mom comes back for them. And in some cases, this is really about community education, because those stray kittens, most shelters don't have a mandate that they have to take the stray kittens. We do it because it's part of our life-saving mission. But then we push it too far, and we actually can have negative impact on their welfare. We really need to educate our community that if you've got stray kittens and you've got a stray mom, is there anything that you can do to help us? Can you foster them? Can you allow them to live in your barn and provide food and support until those kittens are old enough to be separated? Can you help maybe socialize some of those kittens? Can you help us in this project? Because we know that our shelter staff is limited. And so this was one where they said, assess, is there a life-threatening danger to those kittens? If not, let's wait and find out if they're permanently abandoned. And let's give mom up to 4 hours to come back. And then maybe they do have to sweep up mom and the kittens and bring them in because they're in not such a good situation. But maybe there's a way to support them where they are instead of bringing them into the shelter where we're going to expose them to some negative disease impact and stress and all of that. So it is something to think about for your shelter. Is there a place for community education and enrolling some of your community members in helping you in a different sort of way? Foster to adopt programs. Can you provide them with materials to do that to try and minimize the stress on you and your staff? The other item is don't forget about nursing mama care. So getting into some of the medical aspects, don't forget about the nursing moms that we need to provide support for as well if they do come into you. So nursing mom, just to kind of review it very quickly, because I'm sure most of you know this, you want to make sure that you do give them an FVRCP, and that is safe to do. Now, there is some debate around modified live vaccine versus killed vaccine. A modified live vaccine, if the kittens are nursing and they are under 3 weeks of age, has a risk of causing cerebellar hypoplasia, which is a panleukopenia-related, the shaky kitten syndrome. I usually do this and the students laugh at me. So there is a risk if the kittens are under 3 weeks of age. However, it's much more effective at controlling for panleukopenia and upper respiratory viruses. So you have to kind of assess risk for exposure to that infectious disease versus the risk to the kittens. Killed viruses, much safer in terms of cerebellar hypoplasia, but not effective in controlling for the infectious agents. So my general rule of thumb is if nursing mom and kittens are going out to foster, then a killed vaccine is probably okay. If they're staying in your shelter, I would advise a modified live because your risk of those viral agents is much higher. For dogs, here's my nod to dogs. You want to give mom a distemper and a bordetella at minimum. And then rabies vaccines are safe for nursing moms. So please do rabies vaccinate depending on when that's appropriate in your protocol and when you have a veterinarian to do that. Do deworm mom. So pregnancy stresses moms and they will have worms that come out of latency and start circulating in their tissues. And in fact, then that's how the worms get into the kittens, roundworms in particular. So you do want to give mom some Strongid. You do want to give mom some flea treatments. Our topical flea treatments are safe. You just want to make sure the kittens don't essentially lick them off or nurse on them. So there's a little bit of strategy in applying them, but they are safe for kittens. So do treat the fleas. Much worse for those kittens to be sucked dry from fleas. Do make sure mom has optimal nutrition, and that usually means providing kitten food for mom, which is great. Just give her kitten food. It's higher in calories, higher in fat and proteins, and it'll help. Make sure mom's adequately hydrated and do monitor her for mastitis or other signs of infection. Also, mom needs to be happy, right? We want all of our nursing moms to be happy. So warm, dry, and happy is an important part. Stressing her out is not a good idea. More likely to lead to rejection of the kittens, more likely to lead to disease in your mom, which then transfers to your kittens. And so then that speaks to where do we house mom with the least amount of stress? I'm going to talk a little bit about housing in the end, but do strategize about that. Barking dogs, stressful points of your shelter, not a good place for nursing moms and kittens. So that's my nod to nursing moms, because most of the time this is how we get them. A stray litter of kittens walks into your shelter. They just joined hands, walked down the road, and somebody just found them all as a stray litter, right? So stray litter of kittens walks into your shelter. What are our priorities? Well, obviously infectious disease prevention. So deworming, vaccination, sanitation, and I'm going to talk about these in specifics. Thermoregulation, making sure, that's a fancy word for keeping them warm. Nutrition, feeding, and elimination, that's our huge area of focus, and I'll spend quite a bit of time talking about that, especially weight gain and monitoring. Minimizing their stress. It is really important to think about the stress that we put on our kittens and what we ask them to go through. They do have emotional lives, they have social lives, and we've got to be aware of the elements of their behavior which play a role in this. And then socialization, again, best thing for cats is a mom to socialize them. Way better trainers than we are, much better at discipline than we are. And so if you've got a mom, use her. Do not separate her if you can at all control that. So they walk in, first thing, everybody in your shelter should know how to age kittens. And if you need help for that, this is a PDF that's downloadable from the University of Florida. Dr. Brian DeGonji designed this picture photograph of how to age kittens based on teeth, based on weight. So I love this because it's pictorial. It makes it really easy to teach people what's, which baby teeth are in when do we get our adult incisors, etc. So I would download this, I would laminate it, I would stick it on your wall. I would make sure everyone can do it. It's not just that most of you are LVTs, I'm assuming, in this LVT track, or medical receiving staff, but everybody should know how to age kittens because aging them is the very first step in figuring out their pathway, their most efficient and safe pathway in your shelter. Let's talk a little bit about kitten development. So once you've aged them, then you got to get a sense of where they are. So when we're talking about neonates, we're talking about 1 to 2 week old kittens. How do we recognize them? Eyes are closed, ears are closed. They are very, very fragile at this point, and it's estimated about 10% of them probably have some sort of congenital abnormality that's already working against them. Okay? So these guys are super fragile. They do have a righting reflex, which means they'll kind of sit up, but they're extremely wobbly. They really can't ambulate around, and their eyes and ears tend to open at 10 to 14 days. So that's your sign that you may want to think about their first deworming. Eyes and ears open, that's 2 weeks, and that's generally when your first deworming with Strongid occurs. Neonatal, 2 to 4 weeks of age. That's when their teeth first start to erupt. So those pointy little incisor baby teeth start to come in. They do have vision and they can hear you when their ears open. So they're already starting to respond to the environment around them. They cannot independently eliminate until 21 days of age. So important that somebody is helping them, and I will talk about that in detail. They will start to mimic their mom, and this is why it's so much better if they're with a mom. A lot of kittens who aren't with mom wean later, because if you're feeding mom kitten food, she's eating it as early as 2 to 4 weeks of age. They'll start sticking their faces in it. They may not have any teeth to eat it. They may get filthy doing it, but then she cleans them off, so it's fine. Without her, you're trying to get them to eat, and they just don't learn as well. They may watch you. I even try to pretend I'm eating their food. Doesn't work. They walk around in the food and then they're filthy, right? And they don't know quite what to do with it. So do start their deworming at 2 weeks of age, and if you've got a mom, all the better. So here's a kitten that's under 2 weeks of age. I know, they're so cute, right? This is why they break our hearts. Then they look like this. So we're at about 2 weeks of age and we're kind of crazy. We're starting to get some teeth and you're like, please just eat on your own because I'm tired of bottle feeding you, but they don't. Then weanlings, 4 to 5 weeks of age. What's important to know about this is their transition stage for diets normally. So they would start to eat mom's food. We need to start offering them food. And we need to start their vaccinations at about 4 weeks of age, and I'll go over details with that. They still need warmth, they still need guidance, and I'll give you some numbers in terms of warmth. But this is when they start to wean. It's also a time when they tend to do a little bit of a downslide. This is when we see diarrhea. This is when we might see their weight loss or they're holding steady. This is a challenging point for any species, and that includes kittens. Socialization, 4 to 8 weeks of age, they really start to explore their world. If they're living in your house, they really start to tear things apart or climb your curtains if you're letting them do that. 8 weeks of age is when we like to look at pediatric spay-neuter. I'm sure all of you know that. And if you're trying to age them on something other than teeth, you want to remember the rule 1 pound per month of age. That is impacted by what they came in at. So if they came in underweight, they're going to just kind of remain underweight in most cases. We did a weight study at Tompkins SPCA 2 summers ago. And we did find that in some cases, the kittens would not only rebound, but essentially become obese if we overfed them. But most kittens, if they come in underweight, will remain a little bit underweight throughout this period of the 0 to 8 weeks of age. Key socialization, critical socialization for kittens is generally 3 to 7 weeks of age. There is a window of time that goes until about 12 weeks of age. And there's still some, and we're learning more about that, certainly with some of the work that the ASPCA is doing on feral versus friendly. But the truth is that for a lot of kittens, this is their key period for learning about people and what people are like and how the world acts. And so we do want to make sure that we are providing them with opportunity for socialization. So there are some other kittens, and there's some menace to societies. Puppies, here's my nod to puppies, just in case I got puppy people in the room. With puppies, we have the same sort of windows. Neonates are 0 to 12 weeks of age. They spend 1/3 of their time eating and 2/3 of their time sleeping. Doesn't that sound like heaven? Oh, to be a puppy. Their eyes and ears are closed as well, but they will vocalize quite a bit. Kittens tend to take a little bit longer to vocalize, but they will start younger. Their transitional period starts a little bit younger, 12 days, and continues to about 3 weeks, and that's when they actually start solid ingestion, so it's a little bit earlier than kittens. They can start to eliminate a little bit earlier than kittens, which was surprising to me, because I tend to think of cats as being a little brighter, but maybe not in this case. And they do need socialization with litter mates, and Kelly Boland talks a lot more about that than I will today, but do remember that this is also a key window of time for puppy socialization, and it's a struggle for us because we worry about infectious disease transfer and all of those sorts of things. It's always the veterinarians kind of worrying about the disease and everybody else worrying about the socialization, and then there's a little bit of back and forth on that, but we all recognize that it's extremely important. They actually have neurologic development that speaks to needing that socialization. We've got to figure out how to do that safely. Remember, all neonates are immune compromised. And I am known for kind of saying, in a way, all shelter animals are immune compromised. We put them under physiologic stress in a high, often densely housed environment with often less than ideal facilities. And so all these babies are immune compromised, which means they're born without an immune system of their own in most cases. They get passive immunity, so that's your antibody transfer from your mother to the baby. 25% of their Ig antibody, which is your primary one for kind of responding over time, is transplacental. So they actually get it in utero. And then they start to build their own antibody systems at about 4 weeks of age. And that varies depending on mom's health and on their genetics, just like us. But really, their immunity is not complete until 4 to 6 months of age, if we're thinking about them actually developing protection against infectious agents. So keeping them healthy and happy is important, but controlling their environment is probably even more important in some ways in terms of controlling those pathogens. I get lots of questions about colostrum absorption, and there are some studies that differ, but this is what I think is primarily the consensus. When it comes to actually absorbing the colostrum from mom and taking in antibodies orally from mom from their milk, colostrum is in, for puppies, they really have it from birth to 8 hours is their primary absorption through their gut, up to 24 hours in some cases, but you've got that short window where they need to nurse from mom to get a lot of that IG antibody that they're going to get in milk, and that closes, their gut closes at 24 hours, and so you start to decrease their ability at that point. For kittens, it is shorter. Birth to 6 hours. They need to nurse on mom in those first 6 hours to get her antibody protection, and their gut actually closes after 16 hours, and there is no more colostrum absorption at that point. So that window, if there's been some neonates that were born and they're sitting there with their umbilical cords, we really want their mom around. We really need to kind of strategize and figure that out. As a quick aside, early in the spring this year, in the clinic where we work, we had 2 different cats come in as TNRs that we quickly recognized were not only lactating, but probably freshly lactating. And never in my life have I done that, but in both cases, I sent those cats right back out to where they came from and said, we need help, we gotta find these kittens. I'm happy to say in both cases they did. But that's something to keep in mind. As we increase our TNR and our trapping, it is important that we kind of take a quick look and don't let them sit too long in that cage to make sure that we're not missing kittens somewhere, because that could certainly be upsetting if we miss that window of time to kind of help those kittens survive. Preventive care schedules, quick review for you guys on kittens. Vaccinations in shelters, we start 4 weeks of age for our basic FVRCP. If they're staying in your shelter, every 2 weeks until 16 weeks of age. I'm not going to review kind of the maternal antibody thing because I feel like I talk about that every year and most of you have heard me talk about it, but that is kind of our standard schedule. If they're out in foster or not living in your shelter, you may stretch that 2 weeks a little bit longer, but I still emphasize they need to be dewormed every 2 weeks. And it might be nice to have them at least have a foster recheck every 2 weeks. So you want to strategize on getting their deworming taken care of and kind of checking back in on them and their weight gain and their health. And so as our standard, we say start at 4 weeks of age, teeth are in, that's when they've got their pointy teeth, they weigh about 1 pound, and then every 2 weeks until 16 weeks of age. At that point, I hope they're out of your shelter. Modified live FVRCP sub-Q is standard. For this, I get questions about intranasal FVRCs, which are missing the panleukopenia, or now there's an intranasal FVRCP. A lot of people really like the intranasal. Some shelters, if they're really having outbreak problems, will use the intranasal in addition to the injectable, the sub-Q. Do know that the intranasal can cause increased clinical signs, so you can make them kind of snotty and have discharge, and that can be confusing for your foster parents and your shelter. So it may have a place. If you're using FVRC, please note it doesn't have panleukopenia in it. And the intranasal FVRCP, there's competing theories on whether the panleukopenia in the intranasal is as effective as mounting a response. So again, the standard tends to be the injectable. In terms of endoparasites, different shelters have different deworming protocols. Your pyrantel is your typical Strongid 1 cc per 10 pounds. Your pinazeral is your anticoccidial, which a lot of our kittens have coccidial agents, and that has varying protocols. I get a lot of questions on this too. Generally speaking, you're looking at 30 to 50 mg per kg as your treatment. A lot of shelters are using that as a prophylactic at intake. Everybody gets 1 dose. If you are doing a treatment regimen for actual diagnosed coccidia, we tend to look at more of a 3 to 5 day course. And you don't want to forget that you need to bathe them at the end of that, and I'll emphasize that again later. And then our panicures are 50 mg per kg, 3 to 5 days if you're looking at panicure. A pearl I recently heard from a veterinarian out in California, so I'm transferring this piece to you, but that's the only time I've heard it, is that what they're actually doing now is taking their pyrantel and mixing it 1-to-1 with their pinazeral. So they're using their parental as their diluent for their panazeral, if you guys have been using water or something else, which is what most people are doing. And then the dose is 0.25 cc's per pound. And that essentially translates into 1 dose of parental at the right dose and 1 dose of parental of panazeral at somewhere around the 40 mg per kg. And that's their intake dose for kittens. So a 1-to-1 with the parental and the panazeral mixed together. And she's a pretty good veterinarian. So I was like, that may sound like a really good idea. So we're just starting to try it. So I'll put it out there and you can see what you think. Ectoparasites. Advantage is safe. Most of our applications, Revolution, Frontline, at really tiny doses. I will tell you that I officially wrote its extra label to put it on kittens. If you really look at EPA guidelines, it can be translated as being illegal to break up a package and dose that way, so just so you know that. But most shelters will use tiny drops on tiny kittens to treat for fleas. If they're with a mom, treat mom. And then the kittens get all over mom, and that actually protects them. But if they're individual, you need to treat those fleas. You can use some of the sprays and then comb the fleas off too. That's very safe. But most of our flea products, even though they're labeled at 8 weeks or 9 weeks or 12 weeks, are very safe for those itty bitty babies too at tiny, tiny drop doses. Our standard is 0.2 for your average little 2 to 4 week kitten that comes in. And that's been very safe for us, for Advantage. Thermoregulation. If you've got a mom, not a problem. She's a natural warmer. If you don't have a mom, you've got to think about this. So you make a warm nesting box for orphans, and these are the external temperatures you need to provide. So if they are tiny, 1 to 2 week old kittens, remember, ears down, eyes closed, you're looking at 80 to 85 degrees in that box. You can use a Snuggle Safe to do that. You can use the Ithaca heat and humidity, but somehow you've got to keep them that warm. 2 to 3 weeks of age is 75 to 80 degrees, and 3 to 4 weeks is 70 to 75. So the temperature starts to decrease. This doesn't tend to be hard in the summer, but it can certainly be hard in the spring, even in people's houses, or in the fall in this area. I like Snuggle Safes. How many of you are using these in your shelters, these warming discs? They cost about 20 bucks. You can put them on your Amazon Smile page. You stick them in a microwave. Pay attention to how long you heat them. They will melt or explode and ruin your microwave, and they could harm you if you touch the molten lava that they become. So do pay attention to the heating instructions. But I really love these. They're extremely cleanable. They come with these fuzzy little things that you can wash in the wash. But most of the time those things get lost anyway, and we just use blankets. Again, I keep emphasizing it, but if you've got a mom, mom's even better. For feeding orphaned kittens, milk replacer is best. There are all sorts of online recipes for emergency situations. Those are emergency situations. I always recommend using our commercial products because they are well balanced and include all of the important nutrients. You don't want to see taurine deficiencies and other deficiencies in your kittens. So get species specific. Try to be consistent. And this is hard in a shelter. Most of you are probably getting your milk replacer by donation, and it can vary what you get. Again, Amazon Smile, or if you've got an Amazon page, pick what you want to use and ask for that so that you can be consistent. Switching out milk replacer can be like switching out food and cause GI upset. Do know that Whiskas, Catsup, some of those other things that come in like little milk containers are not balanced formulas. If you look at the labels, they are actually just supplements. A supplement by label from the nutritional standards means that it is not balanced as a complete diet. So they are not substitutes. And do follow mixing instructions for your product, and make sure that your foster parents, your volunteers, your staff, whoever's feeding, knows what the mixing instructions are, and that they're using them and not just kind of putting in some powder, putting in some water and feeding. Really important that we balance that. Feeding amounts. This is where math comes into play, or handy dandy charts. I always prefer charts to math personally. So overfeeding can cause diarrhea. Underfeeding can cause diarrhea. I do think in a lot of cases it is overfeeding that contributes to diarrhea in our shelter, because we never want kittens to be hungry, and so as a result, we have demonstrated we produce some really fat kittens, and we do have some diarrhea issues. So it can be tricky because you really got to do some math. Here is your math calculation. The stomach capacity tends to be about 4 mils per 100 grams of kitten. Okay? And their caloric requirement, if you're into calories and you really like math, is 20 kcals per 100 gram of body weight in 24 hours. And then you divide that over their feedings. Do use feeding charts for your products because they do differ if you're going to use calories for that. But there's also handy dandy charts if you hate math. So this is particularly a kitten feeding chart. This is from Maddie's Institute, which is available at an entire learning track they have on orphaned kittens, which if you haven't done it or used it in training your staff, I highly recommend, and I'll give you the link for it later on in the presentation. But this is a handy dandy chart that gives you ballpark in terms of what the weight of the kitten is in grams, and all of your foster parents should have kitchen scales and be weighing these kittens daily. And then it gives you the volume of milk replacer to use and what their stomach capacity actually is in the event that you're tube feeding. How many people tube feed in their shelters from time to time? We have people trained? Okay. So a few of you. I'm going to go over how to do that, so I'm glad I included it. The other thing is really monitoring kittens. So one of the things we instituted, this was a monitoring sheet that we used during our study, which is incredibly detailed. And I have to say, some of the foster parents were like, this is way too detailed, I'm losing my mind. But the interesting thing that we found is that the summer we did this study and used this monitoring sheet, we had the lowest mortality rate in our kittens. So even though it was challenging for them, I came back with, I think we saved more kittens because we forced you to really monitor closely, and I think we caught things earlier. So there should be some sort of monitoring sheet that you are using on kittens, and it may just be weights and stool consistency. This form actually asks them to track vomiting, diarrhea, any URI signs, if they were on any medications on that day, and then what they were eating, because we were really trying to track weight gain and what we were feeding. But I think and fecal scores. So we used the Purina poop chart, which most of you are probably familiar with, and we actually had them track fecal scores. Recognize that a 5 in a kitten can be normal. Their stool is kind of toothpastey or even a little bit loose. A 7, liquid, not so much. But a 5 is fairly normal for kittens. So we did have to do a little bit of education on what is normal in terms of fecal consistency. I really do think that monitoring weight gain and the activity of the kittens is the most important thing. The other thing we found from this study is that the first recognition, and this is not surprising, is if a foster parent just noted a little lethargy. This kitten's just not quite as active today, not quite as active this morning. That was usually a sign something bad was going to happen. And they noted that, and then inevitably by the next day we were seeing that kitten on a recheck. So it's really kind of interesting that those subtle signs can clue you in. And like I said, our mortality rate that summer was really, really low. And so I continue to torture them with monitoring sheets. Feeding times, you know this, small frequent meals, you can look at what the stomach capacity is. When I have taken home bottle feeding kittens, I'm totally neurotic, right? Veterinarian, shelter veterinarian, totally neurotic. I look at what is the stomach capacity, did my kitten eat enough, you know, and I'm doing the same thing you're doing and freaking out that somehow I'm gonna do something wrong. So rest assured, I'm there with you, even after however many years of training I have done. This is really labor intensive. So in the first week, that 0 to 7 days, you're talking about every 2 to 3 hours. You're talking about a kitten basically living in your bosom, and then you're walking around like remembering to feed it every 2 to 3 hours. It's really super challenging, especially if you've got a litter of 3 or 4. The second week, we're talking every 4 to 6. With dogs, again, my nod to puppies, you actually have to do math in terms of how much they have to eat because their weights are so different depending on breed and all of that. And then, of course, learning to read the signals on where they're hungry, which I'm sure most of you know how to do. Bottle feeding, the biggest key point in this is the position. So if you're training volunteers, really remind them that the kitten should be sternal. They eat up with their heads up, not flipped upside down like human babies. And so otherwise they can aspirate or they can get air. And so you want to make sure the kitten's warm. You want to make sure the formula's warm, 99 to 100 degrees, not hotter than that because you can burn them. Stand them upright, have the nipple at a slight angle, and teasing them to really try to get them going. I'll share with you that we are working on trying to develop a nursing station for kittens, similar to nursing stations for calves or pigs, where you could feed multiple kittens at a time and maybe minimize some of this. So we're working on that. I've got a demo model, and because I've got a demo model and we're working on it, we've had exactly 7 bottle feeding kittens this summer. Because that's what happens when you do a study. So if you've got a problem, design a study, and then no animals will show up. That's my little fact there, but I'll let you know how that goes probably next year because we're still trying to refine it. When you are bottle feeding, you need to make sure people go slowly. And how many people are challenged by those rubber nipples and how big to cut the stupid hole, right? It makes you crazy. Guideline is cut an X. That's my words of advice. And actually cut like a center of the X out. Your goal is that you should flip that bottle upside down and there should be a steady drip. Not a stream, but a steady drip. If there's not a steady drip, the hole is probably not big enough. And they always tell you just like an 18 gauge needle punch. No, the kittens can't deal with that. Even the X, a lot of times the little pieces will fold over each other. So I like the X with the hole in the middle, and that tends to work. Bottle upside down, drip, drip, drip every few seconds. That's reasonable for a kitten. And then don't squeeze the bottle as much as you're frustrated and it's 3 a.m. Don't do it. Don't squeeze the bottle. It takes a lot of patience to teach these guys. Again, their moms are way better than we are, and we've just got to work with what we've got. So when they're difficult, like this guy, it's good that they're cute. Make sure they're warm enough. Make sure the formula's warm enough. Do not squeeze the bottle. Look for signs of illness. Stimulating defecation and urination is another big one. So when you're training people or talking to people, if they're not eating, it may be because they're full. I always try to do defecation, urination, stimulation first, feed, and then do it again. Most of the time it's because their bladders are full, their colons are full, and they're not looking to eat yet. So stimulate them and then go back to it. They may need intervention tube feeding, and I am a fan of tube feeding. It's a little scary, it's a lot scary, and it does take some special training. It is not for everyone. But if you've got a core group of people that you can teach to tube feed in your kitten foster program or your kitten nursery, this is actually safer than struggling, squeezing bottles, or like trying to syringe drip. Because to really get in, if you're looking at a capacity of 15 mils in a 3-week-old kitten, a stomach capacity of 15 mils, to sit there with a 1 cc syringe and try to drip it into the kitten, that is a day's work. And that's one feeding. So if you've got some people who are willing to learn tube feeding, I am a fan. And there are ways you can certainly do it safely. It's not without its risks. But I think it's actually safer than pushing formula into a kitten who then aspirates and gets aspiration pneumonia. So if you're unfamiliar with tube feeding or it's been a while since you tried this, how many people have done this in the last 6 months? Okay, handful of people. So tube feeding, you use a red rubber tube like what we use, the red rubber feeding tube, usually a 7 or 8 French. You order these from basic medical supply companies. You want to measure from the nose to the last rib on the kitten. Every kitten is different size. And mark it with a Sharpie on the tube. So you're measuring it on the outside of the kitten, feeling the last rib. That's where essentially their stomach is. Mark it with the Sharpie. Pre-fill the tube with milk. This is important because you don't want to shoot air into the kitten's stomach first, okay, and make them gassy. So pre-fill it with milk, and then you want to pinch it so that the milk doesn't run out. So you folded it. You've got the milk connected to the end. You want to position them upright, same position that they're in for actual feeding. Usually it helps to have a friend, but you don't have to. With a small kitten, I can do this by myself after a lot of practice. You've got 2 tubes. You've got your esophagus and your trachea. The esophagus is more dorsal, more top. So you're going to run the tube along the roof of the mouth. And most of these kittens don't have teeth yet. That's why you're tube feeding them and bottle feeding them because they're not on food yet. If you run it along the roof of the mouth, it'll go down the path of least resistance, which is the esophagus. If they cough, you're going to stop. But generally it just goes whoop and it heads right down, especially if you're using that size. It's a good size for kind of avoiding going down the trachea. And it should pass easily all the way to the last rib because that's where the stomach is. If it went into the trachea, it usually gets held up at the point where the bronchi divide. And so it's going to get stuck a little bit higher and they're going to be coughing. So it runs down really easily. You introduce the milk over 1 to 2 minutes, boom, you're done. You kink the tube and pull it out so it doesn't leak, and that's your feeding, and you've accomplished it in 1 to 2 minutes. Again, I like it because it's fast, it gets the right amount of food into the kittens, and it minimizes the struggle, and I think it's actually better for them. But again, don't do it alone the first time. Get somebody who's done this before to help you out. Kink the tube, slowly remove it, and avoid aspiration. Elimination assistance, before and after meals is important. A lot of people remember the after, but not the before. You're mimicking mom's tongue. I always make a joke that yes, you're welcome to lick them if you want, but generally speaking, we like soft cotton that's a little bit warmed and moistened. Important fact, cats generally are resistant to urinary tract infections, healthy cats. Our two exceptions to that are kittens and old cats, because their concentration ability of their urine is compromised. Kittens are actually very prone to UTIs. And we can introduce that problem if when we're doing elimination, we're kind of not doing the front to back, or we're being a little haphazard, or they're having diarrhea. So just be aware of that as you're thinking about how you're teaching to eliminate or what you're doing. You want to be sure you're not introducing fecal matter into the urethra with the method or the movement that you're doing. Because we actually see a fair number of UTIs in our kittens for this reason. So do you kind of think about that as you're kind of stimulating them, monitor for sores, monitor their stool consistency. You want to keep records on when they've urinated and defecated, especially if you've got multiple kittens, it gets really confusing and you want to keep them clean. Yes? Question, can you use baby wipes? Yes, absolutely. I would be careful about which ones you're choosing in terms of the scented and that additives and that sort of thing. I would choose something that's very plain. And they actually make baby wipe warmers, which are lovely because then they're nice and warm like mom. So that's a great idea. And you can use that to clean them up as well because they can be pretty messy. If you're going to reassign them to a nursing mom, so if you're going to take kittens that came in orphaned or on a mom that's kind of rejected and move them to something else, do try to limit it to 6 kittens per mom. For puppies, it does vary by breed. Do make sure you're chaperoning those introductions. Not all moms want new kittens. Not all moms want to take on adoptions. And do weigh the neonates carefully because you want to be sure, and daily, to make sure that somebody's not getting neglected, especially the one that you added. So in most cases when they've got moms, we feel pretty confident that they're doing fine. But if you've introduced kittens from another mom, they may need more monitoring than you think. I don't encourage you to introduce raccoons into your litter. I think that's a bad idea. So do track those relationships pretty carefully though and make sure that she's accepted them. My general rule is not to mix litters. I feel very strongly about that. Having said that, I also know that there are singletons who really need friends. So my general rule is don't mix them. My exception is mix them understanding the risk and having done a risk assessment. Are we mixing kittens? Are they the same age? Good. Are they both healthy looking? Good. All right, so think about it. Don't just combine them. Do remember that they can share all sorts of infectious agents. You guys know this. But URI, FELV, the biggest one for me is feline coronavirus, which then mutates to FIP, and so there's always a worry. With that coronavirus, it's very high levels in our shelters, and our kittens, because they're so young, often are shedding coronavirus, and then the more shedding you have, the more variants you have of that coronavirus, the more likely you are to see FIP show up in those kittens. So that's one of the risks you take. Dogs, it's URI and diarrheal agents, not surprisingly in mange. And then certainly our worms, our protozoa, our parasites. So I pulled this. Yes, did people know this game, this cat collector game, this Japanese cat collector game? This is the screen the one day I managed to get 3 cats. And I got very excited about my 3 cat collection. So that's my mixing litter slide. But they're virtual, and they don't have FIP, they told me. Weaning. Weaning starts at 3 to 4 weeks of age, and you know that because they've started to have pointy little teeth. If they've got pointy little teeth, you can offer them some food. Start to do it. They may not want it. They still want to chew on the nipple. They want to swallow the nipple, the rubber nipple tops, and then they want to panic you because you're afraid it's going to get stuck. Usually they'll pass it. I have had to go in and take out 1 nipple and 1 feeding tube over time. But truly, if they're still bottle feeding like that, it's time they need to move on when they get to the 6 to 8 weeks of age. They can't take their bottles to kindergarten. That's my rule. My mother did. Don't let her know. Don't tell her I said that. But she tried to go off to kindergarten with her bottle back in the it would have been the 30s, and that wasn't acceptable. KMR mixed with smooth kitten or puppy food is really important for weaning. Meat-flavored baby food is okay. You can use some human baby food. Watch out for onions, which is an additive in those. We don't want to give our kittens onions. And you can mix in milk replacer in small amounts. Do monitor their weights. Get your fosters or your staff tiny little kitchen scales and use them. Be careful about litter boxes. So if we're going to expect them to use the litter box, they have to be able to get in it. Common sense, but just watch the edges and make sure they can actually climb in. This is also the most common time for diarrhea. And so if you're going to start litter box training, short-sided boxes, my rule is anything with diarrhea needs a disposable litter box, end of story. And if I can give all the kittens little cardboard trays, you can use little takeout trays. We have Wegmans where everybody gets their takeouts in those little plastic flat trays. Those make great litter boxes to start with. I like things that are disposable or not scratchable essentially, so I don't worry so much about infectious agents. Non-clumping litter, so they don't eat it. This is a big problem. And if you see that they are eating the litter that you're using, try something different. Sometimes we switch to wood pellets. Sometimes we switch to sweet scoop. We've tried all sorts of things depending on the kitten. And my thing is, if you're eating litter, you can start to eat food. So let's start to try to really push that food at that point. Most will self-teach on litter boxes. I'm always amazed at the 3-week-old kittens that get in the litter box and start using it. Happy day, because now you can stop helping them pee and poop. There's always great rejoicing. I'm sure it's what most people do when their kids toilet train. I don't know, I don't have kids, but I hear that it's pretty much a party. Most of these guys will self-teach even without mom, but sometimes you have to coach them, put them in there, stimulate them, put them in the box, and then they learn. Bathing, my big key point on bathing, because yeah, give a kitten a bath, obvious. What do you use? Basic soaps and detergents. Dishwashing detergent's fine, baby shampoo is fine. The biggest thing is that it's warm and you don't soak them and you let them dry or dry them off well. Absolutely important, if they're having diarrhea, they get baths because of Giardia and Coccidia. Those cysts will survive a nuclear attack and they will live on the back end of those kittens and then they will recontaminate themselves. And you'll wonder why you can't get rid of the Coccidia in your kittens, and it's because they are cleaning themselves as they should and they're recontaminating themselves. So butt baths are extremely important. Do bathe them, do keep them warm. So let's talk about problem kittens. And this is Hava again. This is Janet's kitten living in her suitcase because she's taken it everywhere for the last 3 weeks. So problem kittens, Hava is not a problem, I assure you. But cold kittens, don't try to feed them. It's our natural inclination to want to shove food at them when they're cold and they're kind of unresponsive. Even if you shoved it in there, you can't get enough in. Even if you shove it in there, their intestines shut down when they're cold. They don't move, they get ileus. So feeding them is not going to help. You've got to warm them up first. Warming agents. Human bodies are great. Bosoms, armpits, whatever you got. Shove them in there and warm them up with your body. Snuggle safes are good. You can make your own version of a bear hugger. So those of you who have worked in practice probably had a lovely expensive bear hugger. Most shelters do not have a lovely expensive bear hugger. You can kind of create one if using a blow dryer into a pillowcase that you rubber band around it. And then you kind of make a pillow out of that and put the kitten on top of it. So you can, I wouldn't leave it unattended, but it can help warm them up in an emergency situation. Make sure your environment is warm. Dextrose Caro or maple syrup on their gums will help. If you're in a clinic, obviously IV dextrose, if you can hit that vein. But this is all important. Don't try to do it through food because they're not ready if they're cold. Do know that if you've got access to blood work, and you're doing physical exams, there are parameters that are different in kittens. So we can't compare them to an adult cat when we are assessing their medical health status at that moment. So hydration, we're all taught to assess hydration by skin turgor. Kitten skin turgor is not reliable. They essentially all kind of seem dehydrated at all times because they don't have any sub-Q fat, most of them. Even if they've got big bellies, it's all kind of centered in that big belly. And so they've got low sub-Q fat, it always pinches. Their weight is more reliable because if they're losing weight, that could easily be fluid loss from being dehydrated, and their mucous membranes are more reliable for checking their hydration. Having said that, I'll talk about fluid resuscitation in kittens. It almost never hurts to give a kitten fluids because their fluid requirements are higher. But don't assess their hydration through skin turgor. Their temperatures are colder. So up until 4 weeks of age, they're only 95 to 98.6 degrees. So if they come in at 98, they're not necessarily hypothermic if they're 2 weeks old. So just know that. It helps you kind of evaluate their status. Their PCV total protein, They are progressively more anemic from birth because they're not regenerating red blood cells and they're actually growing and kind of diluting out their blood volume. So they're kind of born at a normal PCV and actually become anemic over time. So just know that they're always going to kind of be a little bit anemic and a little bit of hypoproteinemic. Heart rate is always elevated because it's 200 to 220. It's usually faster than you can count. So they have a very low percentage of myocardium, and they can't actually increase their stroke volume per contraction. And so instead they increase their heart rates when they're challenged. And so their heart rate will actually go up. Their respiratory rate is 2 to 3 times normal of an average kitten, and they have a higher oxygen demand. So just know that can be normal. And their urine is not concentrated. So it's usually clear, and that can be normal. Their alk phos is almost always elevated in a neonate if you're doing a chemistry, and their BUN can be decreased. So if you look at this and you've got an anemic animal with a low urine-specific gravity and a low BUN in an adult animal, that might make you worry about liver failure or something more serious. In a kitten, that's normal. So if you know that, then it helps you not panic quite so much. So let's talk about our most common concerns. Kittens. We're talking about calicivirus, we're talking about herpes virus. Not surprising to those of you working in shelters. We're talking about conjunctivitis, we're talking about herpes virus and chlamydia. These ocular lesions can be severe. Dr. Putnam referred to this in her first lecture. It's really important to keep the crust off of them because the viruses and bacteria are replicating in the crust and the goo. So cleaning eyes goes a long way. Make sure you're doing it. If you're going from kitten to kitten, make sure that you yourself are not a fomite going from kitten to kitten, because I have seen people make that mistake as they go from kitten to kitten cleaning eyes. You don't want to be a fomite doing that. Antibiotics can be important in these babies, and we do tend to use the same sort of ones we use in adults. Antiviral drops. I have become a fan of cidofovir for these kittens that have the really nasty eyes. That's our antiviral for herpes. And it's very expensive, $60 for a tiny little vial that makes you a little bit nervous to even handle. But a couple of days of cidofovir can save those herpes eyes early on. So it's often worth investing in. The normal course, if you get it from an ophthalmologist, for your own animal would be weeks of use, 7 to 14 days. But even a day or two in these tiny kittens can turn their eyes around. I'm amazed at what eyes we've been able to save. So it's probably worth it. Do remember, it's not just about the bugs, so consider all the elements, the temperature, the nutrition, the sanitation, all the other things that we're talking about. It's not just about the infectious agents. Diarrhea. How many of you love kitten diarrhea? How many of you are challenged by kitten diarrhea? Probably everybody who deals with kittens. It can be normal, especially at weaning, so know that. And again, normal stool can be a 5 out of 7. It can be pretty toothpastey soft, and that is normal for a kitten. It can be life-threatening. They can quickly dehydrate. It can be a sign of malnutrition. It can be a sign of sepsis. So your immediate tools, everybody wants to reach for meds, and that's okay, but I always recommend first check your food. Are we overfeeding? Is our formula more than 24 hours old? Was it not properly refrigerated? If your food's okay, let's go to nutraceuticals, a little bit of Fortiflora, a little bit of Benebac, a little bit of Metamucil. All of those things are things that shelters use or mix into formula to try and help with that stool consistency if they're bottle feeding and they're having problems. Do they need antibiotics? Do they need antimicrobials? Are there other things that we need to look at? Could they have coccidia? Probably, so you may want to look at some meds that way. Collecting feces for testing, if you have that ability, really goes a long way. And I'm a fan of actually doing fecals on kittens that are clinical, not everybody. And then making sure you have cleaned the environment. I've seen if you're only cleaning those kittens' cages once a day, they are recontaminating themselves with bugs, with coccidia, with all of those agents. So they absolutely need to be cleaned more frequently. Fluid status, I already kind of talked about this, but know that their maintenance requirements are 1.5 to 2 times that of an adult. So you want to give more fluids to kittens than you would to an adult cat. They have greater fluid requirements. They're not concentrating their urine. They have increased water they're composed of a higher degree of water than adults, and they have increased body surface through which they're evaporating. So their requirements are 1.5 to 2 times. Fading kitten syndrome. Why kittens? Why? Why do you want to die on us today? Sometimes it's just a failure to thrive. Generally speaking, we look at fading kitten syndrome in the first 3 weeks of age is what we're thinking about, and it is absolutely multifactorial. Some of these kittens have genetic abnormalities that we're not going to win against. Some of them were born with really depressed immune systems because their mom was under a lot of stress or she was young. There's going to be things we just can't adjust for. Some of it's going to be your environment. Is it contaminated? Are you challenged? Are you overcrowded? Is your staff under stress and unable to keep up with it? Obviously, everyone wants to know what's the infectious agent that is killing our kittens, but a lot of times it's not something unusual. It's your standard calicivirus. Sometimes it's panleukopenia, and sometimes it's sepsis, which I'll talk about in detail. Often we have no idea what's killing them, or particularly the one kitten in the litter, we just won't know. And a lot of times they can't necessarily be saved, even with critical advanced care. If you are having kittens die, my first rule of thumb is rule out panleukopenia, parvo, kitten parvo. It could be calici, it could be something unusual, but if you've got kittens that are acutely dying, suddenly dying, I highly recommend a necropsy. I highly recommend using the canine parvo test to look for feline panleukopenia, because that is the most common cause of sudden die-off, sudden outbreak of kitten death. And obviously this can be emotionally exhausting. Kittens are very prone to sepsis. So they absorb those bacteria from both the respiratory tract and the GI tract because they don't have the immunity to protect against it. And the signs will be bloating, red mucous membranes. They're predisposed if they didn't get colostrum in that window of time. If they've got other infectious agents, hypothermic. If they are cold, they're much more likely to absorb bacteria, translocation of bacteria, and become septic. If they've aspirated, then those agents are getting in through their lungs. If they had a low birth rate, that's a risk factor for sepsis from the start. And then obviously metritis or mastitis in mom, because they essentially have taken in that bacteria, which then is going right through their gut. These guys really need IV antibiotics and fluids. These guys really need an intervention at a high level, and they do have a poor prognosis. We also did a study when we were looking at kitten mortality. Maybe this is why it was that low, because we also had a study going at that time where we had a pathologist doing necropsies on all of our kittens who died or were euthanized because they were dying imminently. We ended up having very few, probably because we had a study. But what we found is that a significant number of them had toxoplasmosis that was actually looking like an upper respiratory infection, but and then progressed to pneumonia from the toxo. If you remember, toxoplasmosis is a fecal oral, so they probably were exposed from their mothers, and it can be transplacental in the mothers as well and be transmitted to the kittens. It looks like a lot of the other things. They stop eating, they have a fever, and they have lethargy. It affects their cardiac cells, their neurologic cells, their eyes, and their respiratory. And so it can look like your other diseases and be severe enough that it essentially just leads to systemic collapse in these kittens. So we were surprised to find as many. We're actually dying of what looked like a diffuse systemic toxoplasmosis rather than what we assumed was panleukopenia at that time. So how do we manage them? You got to have emergency protocols for these guys, both for the sake of your foster owners and your staff, that there should be some sort of emergency protocol on what happens with really sick kittens. Know what to do ahead of time. And if you're going to have treatment occurring in your shelter and you don't have a veterinarian in your shelter every day to do this, you want to make sure you have standing protocols that outline what the treatments will be for these guys, or they need to access veterinary care. It's very important to stress that foster owners do not medicate on their own. No expired medications, no human medications, nothing like that. Medications from their own pets. When people don't know that there's a plan, they reach for this plan, and this is a bad plan. So that's why it's important there are standing protocols and education on what to do with sick neonates. So in the last few minutes, I'm just going to talk a little bit about kitten management, because there's a couple different ways that shelters are handling kittens. Traditionally, I think a lot of shelters in our area really reach for foster care, and I think that's the appropriate place because our shelters in many cases are not designed to have large groups of kittens that we care for in shelter. How many of you rely mostly on foster for kitten care? How many of you have an in-shelter nursery? Okay, a couple of hands. So foster care training tends to be the mainstay in our specific region. I wanted to make sure that you do know about this Caring for Orphan Kittens learning track, because often foster training is the biggest challenge, because you're trying to do it in the off season and nobody feels the panic, right? Then you try to do it in like February, March, and then suddenly kittens don't show up till May. So you've trained a bunch of people and they're waiting anxiously and there's no kittens. And then all of a sudden you get flooded with kittens and now you don't have enough foster people trained. This learning track is all online. It's beautifully done videos on how to bottle feed, how to do a physical exam, how to help with elimination, and all these things, and what to watch for. And it's a series of lovely videos. You can ask your fosters to do it themselves. You can have a potluck and kind of watch them together. I'm a huge fan of that. Get a group together, watch the videos, and then talk about it. And it's always nice to have some sort of support system for foster parents too. So there's a lot of online information that you can use and not have to reinvent for a foster program. And I actually have an entire lecture on foster programs, so I've reduced it down to this one slide. If you are thinking about a kitten nursery, because we've almost done an about face. For a long time, we kind of crammed all our kittens in our shelter and tried to care for them. We found out that that didn't work because we overcrowded and gave them diseases. Then we moved to kitten foster, and now there is a swing back in some communities to kitten nurseries. So people hear about this and are like, oh, maybe we should start keeping them. Recognize that this is in shelter care of the kitten, but it's not the same thing as going back to just keeping kittens in your shelter. Most of these kitten nursery programs have actually designed a separate building, separate staff, in some cases an entire volunteer team that's 24 hours a day with its own management. And so they've done this in trailers, they've done this in rented buildings because it's a seasonal issue. They've taken over, garages to design this. But in most cases, these kitten nurseries are not just about bringing the kittens back in. It's about a whole new program with its own management. And that's how I would encourage you to think about it. Because I still think that keeping those kittens in your shelter, your traditional shelter setting, is not ideal. I would much rather see them in something that's got its own protocols, its own staff, its own volunteers, and there's a special attention to the socialization, the infectious disease, etc. There's also an element, if you're thinking about that as a kitten nursery, that you really need to have almost two areas, the sick kittens and the healthy kittens, right? And there's all sorts of ways to control the fomite, the movement and the fomite transmission of disease, but you need to think about that in your kitten nurseries. It's not a substitute for foster. A lot of these kitten nursery programs are still using foster, and I've seen it both ways. Some of them are using foster for the 0 to 4 weeks and the kitten nurseries for the 4 to 8. And some of them are doing the exact opposite, where the nurseries are for the bottle feeders, so they can contain them in that nursery and have a rotating staff that comes in to bottle feed and not burden their people in their homes. And then the foster parents take the 4 to 8 weeks. Again, still a separate building, separate staff, separate program. There's a lot of resources online, and I've included references in this, and this is recorded, so it will be available. Thank you all for being here.